All right, Kate Toft, take one. Hi, I'm Dr. Kate Toft. Welcome to OBGYN West. I've been here nearly 14 years.
Dr. Toft is wonderful. She has been my OB for the last 5 years. She's delivered all 3 of my kiddos. She's been there for every complication. I have not had easy pregnancies, and she's been absolutely wonderful. She's kind-hearted, she's thorough, and she's very, very popular, so it's even hard for me to get an appointment.
Healthcare's got a lot of problems right now, and the way quality is measured doesn't translate to what that patient experiences in the office. I feel like we're being asked to check boxes and, fulfill different measures, but that doesn't speak to whether that patient leaves the office feeling cared for or not. That's one of the advantages of working at OBGYN West or a private practice clinic, is I feel like I can have control. If I see something not working well, I have the power to fix it. Versus some of these bigger systems, you have to have 10 other people agree with you before you can actually make that change.
When you're taking care of a patient, you get a sense of how things have been going in their care. And it's just so apparent with all of her patients that every little detail has been discussed and planned, and there's nothing that comes up as a surprise for anyone.
I always say I'm not here to make the decision for you. I'm here to educate you, because oftentimes there's multiple ways to treat something, and everybody has different values attached to different, things in their lives. And I want to make sure that they choose the thing that feels, right. I think the highest praise you can get is a referral from a patient. I have many neighborhoods. That is really fun, because then I get, I'm so-and-so. I'm 2 houses down from so-and-so, so you get the whole neighborhood. Women talk. So if they give a personal recommendation, that they felt safe and they felt strongly that you were their advocate, and they're sending other people to you. I feel like I can't go anywhere without seeing people that I see as patients. I mean, my kids are they're very used to getting, mom gets approached constantly, right? And they used to ask, and now my son, who is 14, doesn't ask. He doesn't want to know. He's like, I bet you I know how you know her. And I'm like, yeah, you know. My son, when he was small, I would run out of the house for a delivery and come back, and he'd be like, I don't understand. Why does my mom always have to go when the babies are coming? Why can't the babies just come? Why do you need to go every time?
Dr. Toft, I think, hits it out of the park on so many different levels. She is a fantastic surgeon. Her incisions are beautiful, and the envy of everybody on the postpartum and the post-operative floors. Everybody is like, ooh, that's a Toft incision. It looks beautiful. She's a fantastic, fantastic person when it comes to mental health and really getting women to think about themselves and take a beat and do some self-care.
Patients, sometimes when you're dealing with postpartum depression or anxiety, it's hard to see it when you're in the moment. And sometimes they need that outside party to be like, wow, I can really tell that you're struggling. This is tough. No, I just feel like it's so important to treat the whole patient, because you're not going to be taking care of your health well if you're struggling with depression or anxiety, or perhaps you have an abusive spouse or something else really difficult going on. My sister always says this is like, how can you do a job where everybody is uncomfortable and not having a good day to see you? And I'm like, well, that's not how I think about it. I think about the fact that she's coming in to get help. And I just try to welcome every patient and try to make them feel comfortable and not awkward, and provide them with safe space to tell me things that they don't tell very many people. Because depending on the issue, especially if it's something very sensitive like sexual pain disorders, or just feeling like their painful periods have been, minimized over the years, I want to make it clear that I'm going to help them figure it out and understand it better, so that they can own their own body and make good decisions about their own health.